Good afternoon, ladies and gentlemen. At the beginning, I would like to thank the organizer for giving me opportunity to present my talk today about the Leishmaniasis during the conflict in Syria, and the impact on other Middle Eastern countries. My talk today will be divided in four main topics. At the beginning, I would like to speak about Syrian war and refugees, and then we'll move to the Leishmaniasis prior and during the conflict in Syria and neighboring countries, and then we'll discuss with the threat of Leishmaniasis to Middle Eastern country and Eastern and Southern Europe. And at the end, I will give you some hints about how to control the spread of Leishmaniasis. So, at the beginning, Syria is known as the most beautiful land in Middle East, and the area where the land of diverse of culture and religion in Syria, and according to all the Middle Eastern. So prior, actually, that's 2011, February 2011, but actually. Since actually the starting of the Syrian revolution in February 2011, a lot of things is changing. So the civilian protesters who actually starting in the two regions of Dara and Homs, so and starting to the fighting with the governmental army, and it was actually excessive power was used in that against the protesters, and as a consequence of this, the whole region after that involved in this revolution, and consequence of that, the civil war started between 2013 until now. The worst scenario was occurred actually when ISIS involved and ruled Raqqa and Deir ez-Zor, and also consequence of that, Kurds in north in Hasaka involved after the war between ISIL and Kurds. So we got about 4 groups fighting each other in Syria, and as you can see here in the map, the Syrian government have 400, almost 500,000 soldiers and 142 deaths according to the Syrian government. For the opposition, we got, as mentioned, is 161,000 and 82 deaths of the Syrian opposition, and 1,200 from Kurds and 14,000 from ISIL. So consequence of this, the big war, and as you can see here as you can see here, so this area is ruled by government, and this area, the green one, is ruled by opposition, and here Kurds and here ISIL. So consequence of this, the big war in Syria, the all infrastructure, all health infrastructure has been destroyed. Hospitals, as you can see in the right-hand side, primary health care, all the facility, municipal facility, sewage has been collapsed, sewage system, rubbish has been accumulated. So was actually the most horrendous human rights situation in the world, was according in Syria now. So consequence of all the previous humanitarian situation, 12 million refugees flee to either internally or external to the neighboring countries. So almost 7.5 million have been displaced to the internally, as you can see here in the map. So and almost 5 million displaced to neighboring countries, to Turkey in the north, Iraq in the east, and Jordan into the south, and Lebanon to the west, and also to the Egypt. And also there's a lot of refugees displaced to Europe through the southern Europe to the central Europe. So with all of this human movement, there's a humanitarian situation with all of the actually previous disasters. So the question is coming, so can civil war and human movement influence the prevalence of Leishmaniasis? So and actually we should, before, to understand whether the Leishmaniasis is endemic in this area or not. So as we can see here, Leishmaniasis is highly endemic in Syria, Jordan, Iraq, and southern Turkey, and all the surrounding country apart of Lebanon, which is reported very few cases, between 2 to 5 cases annually prior to the conflict. And also the parasite vector on Leishmaniasis reservoir have been reported in Syria and neighbouring country. So the area is endemic by Leishmaniasis. The cases reported annually, and also the parasite and vector are found in the most of the region in Syria. So what we are doing actually to understand that, so we're mapping out Leishmaniasis in Syria and neighboring countries. Data was gathered from between 1920s until 2015 from web browser, from PubMed, from Arabian university libraries, from literature, from all Google, from Google Scholar, from all actually web browser, and then also gather information of reported cases and occurrence, which is gathered from WHO, EMRO, and Ministry of Health for Syria and neighboring countries. And we map actually the Syrian distribution of Leishmaniasis in Syria and Iraq and neighboring countries. As you can see, the Leishmaniasis is highly endemic in northwest and north of Syria, and also in Jordan, Iraq, and southern Turkey. And there is diversity of sandfly. So there is Philobottomos regenti and papatazi, and Philobottomos tobi, and several other sandfly. And there is 2 kinds of parasite, mainly Leishmania major, Leishmania tropica, and very few of Leishmania donovani. So to understand the situation before and after the conflict, or before and during the conflict, we have example here for Raqqa and Hasaka and Homs. This area, which is ruled by ISIS here, so ISIS, so it was reported only 62 cases in here, Raqqa, and Hasaka and here is reported 131 cases, and suddenly after the conflict, Raqqa reported more than 2,500 cases, and Hasaka reported more than 10,000 cases in 1 year. So this is the kind of how can human movement and this kind of the displacement could actually make a big outbreak of cutaneous Leishmaniasis in the area. And if you can see here from the pictures, so the sewage where is the place, where is the established the refugee very close to the sewage, and the rubbish accumulation in Aleppo, and in this picture in Idlib. So and because there is lack of disease control and surveillance as a result of civil war, so the disease spread, and no health impact assessment prior to displacement, and the rubbish has been accumulated. There is a drug shortages among the refugees, and also the drug is, the efficacy of the drug is very bad. It's not actually, it's very poor and not have effectively respond to people does not respond to treatment. So as you can see here from the map, that the Leishmaniasis spread, and as you can see here in Syria, in the black color, so has more than 100,000 cases, and the surrounding country also is affected. And if we actually, here we go to the close up the country here, Aleppo and Idlib and Hasaka, which has the worst humanitarian situation here, whereas the Kurds and there's 4 actually group are fighting in Hasaka and also in Aleppo. That's why we got a very high number of Leishmaniasis, and also the disease spread to Turkey and Iraq and Lebanon and Jordan. And to understand the example of the human displacement and how could affect on disease abroad. So we got the example of Lebanon and the red color in the left right hand side, where you can find the refugees in Lebanon, and they received 1,300,000 Syrian refugees into Lebanon, and the Leishmaniasis increased significantly from 2 cases in 2012 to 1,033 cases in 2013. So this is the significant increase of Leishmaniasis in the area of cross the border to Syria. The question is whether Leishmaniasis is a threat to Southern Europe or not. So as a result of human movement and migration. So parasite in Syria is Leishmania major, Leishmania tropica, and the sandfly in Southern Europe, Phyllopotamus tupi, and Sargentii, and Bronchiosis, Butterfly, and Simile. So all of this could transmit, particularly for Sargentii, which can transmit Leishmania tropica, and could have a patient with Leishmania tropica, which is anthroponetic cycle, and require just patient with sandfly to transmit the disease. So this is the question, and I think yes for the disease could be spread also in Southern Europe, or have re-emerging infection. So at the end, so how can we stop the spreading of Leishmaniasis, and how can you address the problem? So the main thing is to enhance disease and vector detection. So, and this is actually one of the main issues. So among refugees in Syria, whereas there is no diagnostic kits for Leishmaniasis, and also very few. There is no healthcare system, no healthcare infrastructure. There is no hospital. All of them destroyed, and primary healthcare center. So the second thing is prevention by improving living condition, where we could actually, instead of building the refugees camp close to the sewage, so we could actually do health assessment prior to establish any kind of refugee camps. And also do indoor and indoor spraying in case of anthroponetic Leishmaniasis, like in Aleppo or southern Turkey, or we could do rodent control prior actually establishing camps in the south, whereas like in Jordan and southern Lebanon. Distribution of medication, which is important, and to avoid also any kind of social stigma consequence of diseases, and also implementation of initiatives. So this could actually help a lot to tackle the problem, and also the research and development, which is the main thing, as very little choice of treatment, and also there is no diagnostic tool easy to use in this kind of situation. So this kind of things is a need to rethink about it and also implement it in future. At the end, I would like to thank my supervisor during my PhD, Alvaro Costa Serrano and Lee Hines, and people from Leo Roscoe of Tropical Medicine, Luis Scully-Hope, and David Molyneux, and Krishanti, and from University of Washington, David Begot and Simon Hay, and Peter Hottis from Baylor College of Medicine. And thank you very much for your attention.